Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then once she is finished, we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I provide today's numbers, I want to speak again about vaccine safety. Safety monitoring is of the utmost importance for all vaccines, and I want to let Albertans know how we are doing that monitoring here. First of all, Canada's review process prior to licensing a vaccine for use in this country is among the best in the world. Both of the vaccines we are using went through a rigorous testing and Health Canada approval process. Here in Alberta, we have now administered 95,243 doses of the Pfizer and Moderna vaccines. These have gone to residents and staff in long-term care and designated supported living facilities, respiratory therapists, paramedics, and those who work in ICUs and emergency departments, as well as healthcare workers in medical, surgical, and COVID-19 units. There have been 18 adverse events reported following the more than 95,000 doses that have been administered, with an overall rate that remains lower than this year's pneumococcal vaccine program. 6 of the adverse events have been an allergic reaction, and these individuals are seeing an allergist before getting their second dose. Other reactions have been symptoms such as diarrhea, vomiting, or a rash. We will continue to monitor every dose that is administered to make sure we're protecting Albertans' health. I'm providing regular updates on this because I want Albertans to understand that we are watching closely and that the benefits of these vaccines far outweigh the risks. I hope this information helps Albertans understand what the options are and make the informed choice to get immunized when it's their turn. That choice will help protect them, their loved ones, and their community. That choice will save lives. Turning to today's update, over the last 24 hours, we have identified 669 new cases of COVID-19 in the province and completed about 14,900 tests. That puts our current positivity rate at about 4.5%. There are currently 167 schools on alert and 2 outbreaks declared in schools in the province. These schools have a combined total of 252 cases, only 18 of which have been assessed as arising from in-school transmission. There are 744 people in hospital, including 124 who have been admitted to the ICU. It is important to remember that it is the number of people currently in hospital that I am providing, not all those who have ever needed hospital care since the spring. To put this into context, over the last 10 years, we have had an average of just over 1,500 total hospital admissions for influenza annually. For COVID-19, the comparable number comes from less than a year of data. More than 5,000 people have needed hospital care since the pandemic began for COVID-19 in Alberta. Sadly, 21 new deaths were reported to us in the last 24 hours. After having a few days of lower numbers, I am sorry to have to report this increase today. Each number represents a person lost, and my sympathies go to those mourning the loss of these individuals, as well as anyone else grieving the passing of someone they loved. To prevent these outcomes, we need to remain vigilant. Recently, our public health teams have been made aware that some employers are asking their employees who have been identified as close contacts of confirmed cases to come back to work as soon as they receive a negative test result and before the legally required 14-day quarantine period. Not only is this the wrong thing to do to protect each other, it is also illegal. A test is only a snapshot of a particular point in time, and someone who has been exposed to the virus can become sick up to 14 days after their exposure. This means that someone who is a close contact of a confirmed COVID-19 case can test negative on day 3 and then test positive on day 7. That's why it is critical that the mandated quarantine and isolation protocols are followed and respected. I would ask that all employers respect the need for staff to isolate for the full mandatory period and support them however possible during this time. We have also heard from some families who are wondering how the eased restriction for outdoor social gatherings applies to those living in continuing care. This includes long-term care, designated and other licensed supportive living facilities, and hospices. Across Canada and right here in Alberta, we have seen the tragic toll this virus has taken on the elderly, especially those living in continuing care and congregate living settings. The impact on the physical, mental, and emotional health of these residents has been significant. The restrictions implemented over December have also been very difficult for the families of those living in care who have been unable to visit them in person. Change to outdoor social gatherings does impact how you can gather at continuing care facilities. Facility operators are now permitted to use outdoor designated spaces on site for outdoor visits with a maximum of 5 people, including the resident. If residents are able to go off-site, they can participate in an outdoor social gathering with up to 9 other people. In doing so, the residents may be asked to use additional safety precautions on their return to the facility, so it is good to discuss those before leaving. In either case, physical distancing must be followed during the gathering, and additional precautions, such as wearing a mask at all times during the outing, are recommended to protect the resident who is more vulnerable to COVID-19. All visits must be pre-arranged and coordinated, so please contact facility staff in advance to discuss the best options to safely visit your loved one. It's also important to consider the weather, dress warmly, and to stay home if you're feeling even slightly ill. This is true for all of us. While this pandemic is now more than 10 months old, it remains essential that we all stay home if there are any symptoms and book testing as soon as possible. This is still one of the key ways that we help protect not only our own health, but the health of our friends and neighbors. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Thank you. Yes, the first question is from Kevin Nimick, CTP Calgary.
Hi, Dr. Hinshaw. Why isn't sector-specific COVID-19 data available to the public? And would it be easier for you to justify restrictions if people knew the reasoning behind your decisions for things like keeping gyms closed and restaurants?
We have had the request for sector-specific data frequently, and we are working to put together a summary of the sector-specific data that we have available from all of our follow-up post-relaunch. And so we will be making that available when it is complete in the coming weeks.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Some restrictions were eased on Monday. At what point or when do you expect AHS to resume surgeries, diagnostic imaging, and other clinical supports in the Edmonton zone that had to be delayed the last few months?
The decisions about when other services can restart is entirely dependent on how quickly the burden on acute care is eased by COVID-19 patients who require care. So the timing, again, will depend on all of us, how we're bringing the transmission down, which eventually will lead to reductions in hospital numbers. But as I mentioned earlier, we still have a very high number of people in hospital, and it's only when all of those individuals who no longer need care can be safely discharged, and we are no longer having numbers coming in from those who newly need care, that there will be enough capacity in the healthcare system to be able to resume additional services that currently are paused, so those resources can be allocated to that pressure from acute care COVID needs.
Operator, could you put through the next question, please?
Jeff Labine, Edmonton Journal.
Hi, Dr. Hinshaw. How encouraging is it to see a positivity rate of 4.5%, and do you consider the restrictions put in place in November, December to be a success?
It's very encouraging to see our positivity rate steadily declining since the peak in December. And I would say that the data that we have indicates that the restrictions put in place in November and December have achieved so far their intended outcome. What is critical at this point is that we maintain enough measures to continue going down. As I mentioned earlier, while we have lower case numbers and lower positivity rates, we are still seeing a large number of people still needing hospital and ICU care. And so we need to build on our collective success by going slowly towards allowing some additional activities and not experiencing a rebound if we open too quickly.
Operator, could you put through the next caller, please?
Jason Herrick, Post Media.
Hi, Dr. Hinshaw. I spoke with a few healthcare workers this week who are frustrated by canceled vaccine appointments. One of them even told me the decision had employment consequences for her after a employer passed on her because she hadn't yet been vaccinated. Wondering what you would say to healthcare workers upset about the delay in vaccination, and I'm wondering whether there's a timeline for when healthcare workers who have not received their first dose to be immunized.
First of all, I understand how frustrating it is, especially given that as late as last Thursday, before we were aware of the Pfizer vaccine shortage, we were strongly encouraging all healthcare workers to book appointments as quickly as possible. So I can imagine how frustrating it is to have many people who were doing their best to get that vaccine, only to have the vaccine supply change so quickly after that. Unfortunately, with the numbers that we're seeing right now in terms of the anticipated Pfizer doses that will be coming to us in the next several weeks, we simply do not have enough vaccine to be able to both provide second doses to those who've already received their first and also to offer first doses to additional people. I would ask healthcare workers and others to be patient and to assure them that we're doing everything we can to plan forward to make sure that when we do have enough supply, that hopefully the experience of booking and receiving vaccine will be as smooth as possible for them.
Operator, could you put through the next question, please?
Carrie Tate, Globe and Mail.
Hi, Dr. Hinshaw. Thanks for taking my question. I'm wondering if you can give us some specific examples of what Alberta has done to work with federal government and local partners in Indigenous communities that are still suffering from really high test rates.
Thanks for the question. I want to emphasize that my admiration for the leadership that First Nations and Métis leaders have provided in their communities continues, and that for the first many, many months of this pandemic, the rates in First Nations and Métis communities were lower than outside in the general population. Unfortunately, as we saw the rates in the general community rise in the late fall, those did have an impact on First Nations and Métis communities. And unfortunately, as you referenced, there are many now dealing with outbreaks that are very challenging to control. We have been meeting with different First Nations leaders. We have also been working with Alberta Health Services to determine how we can best support the efforts of the local leadership as well as the First Nations and Inuit Health Branch in being able to support testing, being able to support where needed, if there's any supports required in the isolation and quarantine locations that are available to support people who are living in crowded households. And of course, continue to have conversations with respect to how we can offer other supports that these communities might need.
Operator, could you put through the next question, please?
Yes, our final question is from Dean Bennett, Canadian Press.
So, hi, Dr. Hinshaw. Can you clarify for me the vaccination situation in the sense that there was a push on before around Christmas to do first doses, and now we've done 95,000. But now we're into the second window of doses for second doses, but at the same time now they're facing a shortage. Is there a possibility that some Albertans will not get the second dose they need within the appropriate time window? And if so, what does that mean for them?
We offered the first dose, as you know, starting in mid-December. So we've actually already been providing second doses to those Albertans who are eligible for it. with the current situation and the significant shortage that we're facing, we are needing to adjust plans. And so, as you know, that does mean in the interim, we're unable to offer first doses for a period of time. With respect to second doses, we are prioritizing residents of long-term care and designated supported living facilities to receive their second dose within the 21 to 28 day recommended interval. And we are also looking within our available supplies to be able to provide the second dose to all others who've received their first dose within the maximum allowable window of that 42 days that was endorsed by the World Health Organization and the National Advisory Committee on Immunization. So right now, again, there's detailed planning underway to look at those allocations that are going to be coming into the province, and we will be doing everything possible to get the second dose to those individuals, again, within those 2 time windows.
All right, there are no more questions in the queue, so thank you for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.